Hi, my name is Brenda. I'm a dental assistant, and I just wanted to give you an idea of what you can expect to have happen if you need to have an extraction done. Okay, come on in. We're going to go into the room now. All right. So here we are. This is our dental operatory. This over here is the doctor's side of the room. This is the computer where you see the doctor and the assistant entering the information. This is where you're going to be sitting. This right here is going to be over here like this. This is the assistant's chair over here. And this is where we're set up for our extraction over here. Okay? So what we're going to do is, first of all, you're probably wondering why you need to have an extraction done. It's because your dentist has already done everything they can to fix your teeth, and they're now deemed, I'm sorry to say, but your tooth is now deemed hopeless and non-restorable, okay, which is why you're here today for your extraction. So the first thing that we're going to have you do is we're going to have you swish with our Medicaid mouthwash. It's called Paradex to help get your teeth nice and clean. And while you're doing that, we're going to have you swish for a minute and then spit out. The assistant's going to sit here and put your bib on you. I'll give you your glasses. The assistant's then going to give you your consent form. And they're going to go through this with you and explain exactly what we're then going to have you sign. Okay? This right here is going to have on, we're going to explain to you exactly what tooth it is that we're going to be extracting. The doctor will explain to you the reason exactly why your tooth needs to be extracted. We're then going to hand you a mirror, just like this. You're going to be able to look right in your mouth, and the doctor or the assistant's going to exactly point to what tooth it is we're about to extract. Okay? And after that, the assistant is then going to come on over to the computer, and the assistant and the doctor together are going to be having you sign on your computer chart. It's called an IMED consent form of what you just sat here and read on the consent form. You're now going to sign saying that you totally understand what's about to happen. And then we're going to hand you this right here. We're going to have you sign it, the little pen we've got here. We're going to have you sign it, and then we're going to save it to your computer chart. So it's totally going to be saved that you consent to what we're about to do. So what's going to happen next is the doctor or the assistant is going to place the topical, which is this right here. And then the doctor is going to give you whatever sort of local anesthesia that you're going to need. Here in our dental clinic, we use the same, it's called local anesthesia, and it's the same as what we use whenever we're doing either root canals or restorations or crown preps or bridge preps. Okay, so we're gonna, after we do that, the doctor is going to give you a couple minutes to make sure you're good and numb. She'll then take one of the instruments, and she's going to gently poke that tooth that's going to be about to be extracted just around the area of it to be sure that you're good and numb, is what we call it. Her and the assistant are then going to put on our special latex, our special gloves. These are only used for surgical. Okay. And then I wanted to show you just a couple of the basic instruments for a simple extraction. If the tooth is really loose, then we usually project it's going to be an easy extraction. So what we do is, first of all, the doctor is going to go around the tooth with what's called a periostal elevator right here. And then the doctor's going to ask for, this is a small elevator. And then, as we're ready, mobility-wise, we're then going to use the larger one. And then we have many different forceps depending on where the tooth, which is about to be extracted, is located in the patient's mouth. Patient is going to have, at the very most, 32 teeth in their mouth, and there are different forceps for all different areas. The mouth is made up into 4 different quadrants: the upper right quadrant, the upper left quadrant, the lower left quadrant, and the lower right quadrant. Okay, so you have 4 quadrants in your mouth, and all different forceps depending on the special situation of that tooth. Each tooth is totally unique. Doesn't matter what number it is, but each tooth has a totally unique situation. So after the tooth comes out, the doctor is then going to use this right here. It's like a spoon or an excavator, and the doctor's then going to take out anything extra, like if there's pus underneath where it's called a tooth socket, where the tooth used to be, okay, that's now been extracted. The whole while the assistant's going to be using the suction tip to keep you all nice and clean, removing any blood that should come out, okay? We'll check before doing the extraction, and we'll always ask the patient, first of all, if they're on any blood thinners. If we're on any blood thinners, So we'll make sure that you're not gonna be bleeding excessively after this extraction. So let's see, where were we? We were, okay, after the tooth has been extracted, the doctor's gonna clean out anything extra that happens to be in there. We're then going to irrigate with our special sterile water right here, okay? This is gonna be our syringe with our special needle that we use. It's a blunt tip needle. If it's deemed by the doctor that you need sutures, which sometimes you do and sometimes you don't, we won't know until after the extraction's been done. But I always, as a dental assistant, I always have these sitting on the standby just in case we should need them. This is called gel foam right here, and it's a special medicated foam that the doctor may choose to put into the socket where your tooth was, just to help it out a little bit with a little bit of medication. Okay? And as I was saying, we always have sutures ready at the standby in case the doctor needs it. So we have different types of sutures. We have Vicryl ones, which resorb after a couple of weeks, and then we have ones like this, which are Chromagut. So some of our sutures need to be removed after a couple of weeks, and other ones are naturally going to resorb. And you'll be given instructions by the assistant and the doctor before you leave as to which ones you have in your mouth and when you're supposed to be returning to have the doctor look at how your tooth is healing. Okay, so everything's doing really good right now. What's happening is, in your mouth, is the doctor has now taken a couple of 2x2s, put them under some water here, squeezed out the excess water, and you know how this, it's like a little padding inside of your mouth. It's nice and comforting where your tooth was. Okay, so when you leave our dental clinic, you're going to have a couple of 2x2s that are moistened, just like that, in your mouth. Okay, we're also going to go over very awesome instructions that are very important for you to follow, and we give these out every time we do an extraction. They're the same instructions, they haven't changed for years. The assistant's going to totally go over all of this, step by step, very important directions of what you're going to need to do the first 24 hours, as well as starting after the first 24 hours for a couple of days after that. Okay? It's going to include what to do if you suddenly start having pain and you may have a dry socket. It's also going to tell you exactly what's going to happen concerning what you're supposed to eat for the next 24 hours, and also if you have stitches and what to do concerning that. Okay? Also about not going to the gym and doing anything strenuous the very first day. Okay? It usually takes up to maybe 8 weeks approximately for the tooth to totally heal over the socket of where the tooth used to be. It's very important in that time not to have any popcorn, because a little piece of popcorn can get stuck inside of there and you want it to heal over really nicely. Okay? The doctor will probably want to see you after that, and then and the doctor at that time will explain to you, you know, what's going to happen as far as replacing where that tooth socket is, where your tooth used to be. It may be an implant, it may be a partial, could even be a denture if you now have no teeth. Alrighty? Thank you so much. Have a great day. Thanks for watching me. Bye-bye.